Speaker, to the Minister of Health and Long-Term Care. Speaker, for some time now, we've known that funding for seniors' care in this province has been inadequate. My offices regularly receive questions about long-term care. This week, one of the most astonishing things I've heard in all my 27 years as an MPP was that the government is completely abandoning Mr. and Mrs. Jerry and Rita Bartolo. Their son Raymond has been told that although they both qualify for 56 hours of personal support care per week, there are no PSWs to provide that care. Instead, they were given a list of private home care companies to call. Mr. and Mrs. Bartolo are also on wait lists for beds in long-term care, but there are no beds. According to Health Quality Ontario, the average wait time for a bed in long-term care in both the Central and North Simcoe Muskoka LHINs is 220 days. That's an extraordinary amount of time for seniors in need of care. Speaker, I ask the Minister, since when did it become the policy of the Government of Ontario to abandon seniors who qualify for both home care and long-term care?
Minister of Long-Term Care.
Thank you, Mr. Speaker. And first of all, I'd like to say I'd be happy to work with the member opposite on this specific case to see what can be done. I'm not familiar, of course, with these individuals. But, Mr. Speaker, it's important to recognize, well, in fact, just last week we announced an additional $40 million this fiscal year for home care services. And we're continuing to make those important investments in long-term care as well. The member well knows that we've built 10,000 long-term care beds while in office. We've redeveloped 13,500. But we understand, because we have a growing and aging population, and a population that, quite frankly, any of us who have visited long-term care homes know that the acuity is higher as well. There are more complex patients. They tend to be even more elderly and frail, and their needs are very specific. And so we're investing in those supports, be it PSWs or RNs or other supports, behavioral supports, to ensure that they're getting the care that they provide. But it is a work in progress. I hope the member realizes and takes me up on the offer to help.
Supplementary.
Well, thank you, Mr. Speaker, and I want to thank back to the Minister. Thank the Minister for his offer of support. Just a few more details. Mr. Bartolo was discharged from hospital after being a month in hospital, and no arrangements for home care were made. The family was promised, starting Monday of this week, that PSW care would be available. However, it's now Wednesday, and there's no care. The Bartolo children are doing the best they can to support their parents, but shockingly, they've been told that they may never be able to get a PSW to work in their area. They live near Cookstown, about halfway between Barrie and Alliston. They're on the border of two LHINs, North Simcoe and Central. They really should be getting PSW help from Central, and yet the North Simcoe LHIN that we're working with says they can't share resources or information with the Central LHIN, which is bizarre. And apparently the North Simcoe PSWs don't want to go that far down south in Simcoe County. They don't want to drive there because they're not reimbursed well enough. So I do appreciate your offer of support and working with me.
Thank you. Minister.
Well, Mr. Speaker, I think, it sounds like this is a challenge, a particular situation that we can help with. So it's important that when situations like this do arise, that we work together. I know the member has a history of working closely with me, as do many of his colleagues, on specific cases. And there are aspects of this that just don't seem right or proper, Mr. Speaker. But it is important to recognize as well that this year alone we invested an additional $100 million, apart from the 40 that I referenced in the first, $100 million in home care supports, which provides specifically an extra 1.3 million hours of PSW care. Now, I understand that this is a challenge which has to do with different LHINs, as well as the residency of this individual and other aspects of this which just don't sit right with me. So I'm happy to work with the member opposite, as we have done previously, and I thank you for bringing this forward.